Episode 6. This is going to be a really short one because I'm still recovering from being sick. But this episode is about me having to use my health insurance and part of my emergency for the first time in 2026. I wanted to share this thing that had happened to me. Over the past week, I've had not only the flu, but pneumonia as well. Now, this experience, it sucked tremendously the entire time. And today is the first day that I'm like, yeah, I'm good. No dizziness, no headache, nothing. Yeah. In part of this experience, I did have to go to the ER. That also sucked. And I had to find out that I had pneumonia. That was not a great thing to happen. The doctor was very much like, you're having a hard time fighting off the flu because you have pneumonia too. Not the way you want to find out. Not something you want to do. I had to be on an IV, all these different things. It really sucked. But this experience, in all the suckiness, turned out to be a really good learning experience for me too. So I just wanted to share a little bit about it because it did a lot for me both physically and financially. So let's break it down. Let's first start with physically. I know the old cliche is health is wealth, and nobody wants to hear that. But nobody wants to hear it until you're sick in your bed and you can't do anything, you can't work, can't do nothing, and you feel horrible. But health really is wealth. I wasn't able to do any shoots. I wasn't able to do any work. All the things that I thought that I was going to be able to do, even though I wasn't feeling well, I was not even able to do in the slightest. Your health is your wealth. So as long as you feel healthy, you can do plenty of things. But when you don't feel healthy, you can't do nothing. What I can say is I don't usually get sick, and not being able to do nothing, not being able to do anything really was a setback for me. But taking that time to recuperate and rest really sped up the process of my healing, and my overall healing was much better because I took that time to do things instead of trying to just jump right back into everything. Also, my environment is very nice. I'm somewhere safe. I'm somewhere warm. I could say I'm grateful for where I live now because my rest was uninterrupted, therefore unhindered. So that was a really great thing for me. And the next thing, it's really about my work. My job, fortunately, it's perfect for me. It's a perfect fit. I love where I work. I love how I work. Love everything about it. My work didn't have to suffer because one, I already work in a hybrid position for PBS. On top of that, my management and part of the team were there to help me pick up the slack that I would be leaving behind. Even though I didn't really leave anything behind, but they pushed things back for me. They said, hey, I want to be part of the meeting. This, that, and the fourth. It was super simple, super easy, super simple, nothing crazy at all. So I can say very, very supportive to say the least. And that took a lot of stress off me that would normally have me very stuck. That was nice. Now let's talk financially. Now I have health insurance with my job. Not everybody has that, and I understand that. But I'm speaking from my perspective. This is also my first time having a job that has health insurance. So another thing that I understand a lot of people don't have it. I have it, so I want to speak on it. The first thing I learned is I need to make a list of in-network emergency services providers in my area and how far they are away from me. Because when I went to the ER, I ended up having to have to pay for an out-of-network ER when I could have gone maybe 10 minutes more down the road and gone into one that was in-network for me. Because, yeah. Now, granted, for me, going to the out-of-network one would have been the key anyways because I was in such bad shape that I was like, I want to go see someone now. I want to see someone close. But when I looked back, I could have paid a $20 copay instead of a $75 copay had I just gone to one that was in network instead of out of network. It's not a huge hit, but it is a $55, it's a $55 hit that I didn't have to take if I would have just looked into that before I left. But that brings me into my next thing is utilize your emergency fund in times like this. Because if you have to go to the ER, you have to go to the emergency room. That is an emergency. That is when you can pull from your emergency fund. So for me, I was able to pull and cover the cost of everything from that fund without having to touch any of the money that I've made and those different things, just because that situation had arisen. And I wasn't worried about it because I knew, well, I can pull from my emergency fund and it's not going to be anything extremely crazy. But even if it was, it's like, let's dip into emergency fund first, and then I can move forward into covering any additional costs with my out-of-pocket stuff. When I went to the ER, I had to pay for an IV, I had to pay for medication, and I had to pay for a general checkup just to be okay. Now, fortunately, my health insurance covered some of it, but it didn't cover all of it. So my emergency fund had to cover the rest. But because I had this emergency fund, that hit didn't feel so heavy, to say the least. So I can say, just in these times where, your health and sickness and things can cause you a lot of detriment financially, I would say do your best to have money set aside for situations like this, so that, one, you can get the medicine, the help, and everything you need to recuperate quickly, so that you can continue to work, so that you can continue to bring in income, and you can continue to do these things for a long time for yourself. Because if you don't, things get really hard. I'm going to keep this episode very brief and short. That's really all I've got for you, because I do want to get back to getting some rest, and I'm still not fully all the way back 100%. So it is something that I wanted to share, and something I hope you can take and apply to your life the next time you may get sick, or someone else may get sick, your friends may get sick, or just something comes up that hinders you. So everybody, I'll see y'all later. I'm going to go get some more rest. Peace.